Hello friends, this is my English version of the hair transplant surgery experience video. So in this video I will show you my status of hair transplant, experience of hair transplant, and the couple of days after which the bandage on your donor area is removed. I will show photos and the status of that time. So I'll not be wasting time with the intro again and again, and I'll be coming directly to the point. This will also happen in my next videos as well. So without wasting time, let's go to the video. So this is my video in short hair before the hair transplant. You can see in the crown area there is a big bald patch. The hair are there, but they are very thin. In the front also you can see there are very thin hair. There is not the video in proper lighting, so that's why you cannot see it properly, but you can see the hair thinning is there. There are bald patches in between the hairs. Hair are there in crown area as well. So this is the photo which is more clear. You can see there is a big bald patch in the crown area, and there is a small bald spots between the hair in front area and the area between crown and the frontal part. So this is the photo just after the hair extraction. So they just cover your donor area with the bandage. You can see some blood is also there in the bandage, and yes, this is the photo from where the hair follicles are extracted for the transplantation. So you can see safe donor area, high risk of thinning area. So this is the photo immediate after operation. You can see how the transplant has been done. There is not much swelling, and you can see the technician is doing bandage in the donor area. This is the photo just after the operation. They give you a cap to wear in order to avoid infection. So when your head receives trauma, it automatically starts the healing process, and as a part of healing process there is some fluid which extracts from your scalp for the healing process. So you can see there is some fluid also. So this is you can see there is a swelling. This is the next morning after hair transplant. Because of the trauma and extraction and transplant, a lot of itching happens in the scalp. So that's why they give you saline water to irrigate the transplanted area regularly, so that you can avoid itching. You can see the small red spots which are the hair transplanted in the crown area. The coverage in crown area is not that good, which I'll cover in the later part of the video. For sleeping also, for at least 2 days before the bandage has been removed, you have to sleep like this. You can so that the swelling which happens in the scalp because of the transplant and anesthesia goes back to your donor area and the top position of the head. So this is how I used to sleep during the after. This is the photo of donor area after my bandage has been removed from the donor area. So you can see the extraction has been done properly. There are not big bald patches of extraction, and what happens is that because of the automatic healing process, body excretes a certain fluid for the healing process, which gets so that the bandage gets stick to the donor area. That's why they pour some solution so that it can be removed properly. This is the front hair. This is the frontal part after bandage removal, and you can see there is a lot of swelling, and because of the anesthesia and the head trauma because of the transplantation, you get a lot of swelling. So you can see there is a swelling below my eyes as well. This is the condition of donor area next day after the bandage removal, and there is some swelling in the donor area also. You can see because of the trauma and the extraction. In the front also you can see the hairline has been done properly, and there is a lot of swelling. This is the crown area photo just after the bandage. This is the next morning photo after the bandage removal, and you can see overnight the swelling has come down to the face also. And yes, this is the photo of top part where the transplant doctor has tried to give me the maximum coverage in the available grafts, and you can see before and after images of transplant, and you can see how much difference there is in face after the transplant. Because of the head trauma and the anesthesia which they give you to avoid pain during the surgery, the swelling happens, and you can see the swelling has come from the top to the face as well. And yes, before and after images can show that how much swelling is there. And this is the donor area condition. You can see the hair has grown a little bit, and you can see the transplant has been done in between the gaps of the existing hair. So the main reason why I chose for hair transplant, decided to go under the surgery, that because I already have hair, but they are thinning and there are bald patches in between the hair. So before those hair follicles become dead and I have big bald patches, I opted for the surgery so that the newly transplanted hair can give the blood circulation to the existing hair and they can also become thick. So that was my main purpose, to go under the knife and get hair transplant. This also, you can see the extraction has been done properly. There are no big bald patches, and this is the frontal part. I already had this hairline before the transplant, and I didn't wanted to increase the coverage of my frontal part. I was happy with what I was having exist already. I just wanted to have the hair in between the bald patches so that my hair looks fuller and the existing hair follicles can also survive. So that was my main purpose of going under the knife and getting hair transplant. Mainly the looks comprises of frontal part. If your front part is good and the side part is kind of covered, there are very few chances that somebody looks at your crown area. You can see in this crown area there is a big bald patch in the crown area, and then my main area of concern was crown area, because I had hair everywhere, only the big bald patch was in crown area. But unfortunately there were less grafts when the transplant started in the crown area. Initially when I met the doctor suggested me that there should be 3500 grafts for the transplant, but when I consulted the doctor in person, the doctor advised me that okay, 2500 grafts should be enough because you already have hair. But when the surgery happened, the priority was to make the frontal part good looking and to create the already existing hairline and to give it a dense look. But when the surgery reached up to the crown part, there were less grafts. So that's why unfortunately I had very less grafts to be transplanted in the crown area. So I was actually very sad to see this result after few days of hair transplant, and I raised my concern to my plastic surgeon and said that I'm really disappointed with the crown area. And he said that he didn't argue a little bit. He said that yes, it has happened. There were very less grafts remaining for your crown area coverage, but if the result does not come in 6 to 8 months, your next session will be on the clinic. I don't have to pay anything for the next session for the crown part. So that is why you choose a good clinic, because a good clinic can provide you post operation support. Yes, it is unfortunate. I was sad, and nobody wants to go under the knife again and again, because you receive a lot of head trauma, and you have to go for blood test, you have to go for ECG, and you have to opt for physical fitness. Then for 6 hours this hair transplant was happening, and full day you are in operation theater, and after hair transplant you have to take 10 days of rest. So it's a big thing. I mean, you have to take holidays, you have to take time to go under the knife. So nobody wants to go under the knife again and again in one go. Everybody wants that their work should be done in a perfect way, but what we can do. And I didn't opted for some cheap clinic. My operation was done by a hair transplant surgeon having 15 years of experience in surgery. It is just a matter of unfortunately there were less grafts to be transplanted in my crown area, and the doctor completely accepted it. And we will try to get the maximum result possible in the crown area with PRP medicines and other techniques. That also I will cover in my future videos. And in the front part you can see it has the existing hairline has been reconstructed properly, and the hair transplant has been done in the patches where I did not have hair. So this is the 4th day photo. You can see there are the hairline in the front part has been done well. The only concern of crown area is there, and we'll work on it. So this was the video, guys. I hope you like it. So in the coming videos, I'll be, at the moment my hair transplant is almost 1 month. So this is the condition. I'll be making video in sunlight about this hair transplant and the condition of crown area in the coming videos. So I'll be uploading those videos very soon. So I'll be uploading the result of my 1 month and the recommendation which I can give you according to my experience, the cost and the clinic and the medicines which I am taking for this hair growth. So at the moment it's 1 month, so I'll be uploading videos regarding my first hair wash up to fifth hair wash. How's the condition look like when you wash your hair up to 5 times? What kind of shampoo I am using? I'm not using Johnson's baby shampoo, which is usually recommended. So I'm using medicated mildy shampoo, but I'll cover that in detail in my coming videos. So I'll try to cover the videos very soon till the 1 month of the result of my hair transplant, so that once I am done with making videos, it is up to the 4 days of my condition. So today I'm making video, so I'll try to make the video of current status in the next 4 videos and try to upload them. So this is how I'll be keep making videos, so that we are in you will be getting the most updated videos. Okay then, so if you like this video, please subscribe. It is really important to me. Thank you.